It is Tuesday, November 24th, 2020. And welcome to the Kahnawà COVID-19 Task Force Update. This is our 153rd episode, and on today's program, we'll be visited by Lisa Westaway of the Kahnawà Memorial Hospital Center. However, we'd like to start things off with an update from Arnold Lazar of the task force. Arnold?
Good evening, Kahnawake. Three quick items today. Lloyd is off on a well-deserved break. First is we need to address the two household directive that went out. There seems to be some confusion, so we'd like to once again re-clarify just exactly what it means. In an effort to ease the social tension or the stress, it's been allowed to have two households. Now, by that, we mean your household and another household. Some people may have called it bubbles, but so if you have family members, you can invite your household and another household to meet, and we're recommending that it be once a week. This is to help ease the tension. We are looking forward to Christmas, and we suspect that things may change, but in the meantime, we're asking people to limit it to their household and one other, because we're seeing that history is unfortunately repeating itself. With the Spanish flu, the second wave was much worse, and unfortunately we are in the same situation as a long time ago. The second item we'd like to talk about is the masks and taxis. A question came in today asking, should taxis be wearing masks? And the directive is yes, everybody in the taxi should be wearing a mask. Once again, it's a confined area. Now, unless the taxi has a designated shield or barrier, then the mask is not required. But given the circumstances, everybody should be wearing a mask. We just need to continue with what we're doing. Social distancing, masks, and hand sanitization. And then the last item that we're going to talk about is, with Black Friday coming, of course, the recommendation is that there be no long distance traveling. We're recommending that people don't travel. And in a communications meeting today, we talked about alternatives. So if people are going to order, and there's going to be a lot of Black Friday specials on the internet, we're just reminding people that it is a good way to shop, but they should use a third-party payment program similar to PayPal. What this does is it gives them a little bit of more protection in case the items don't arrive, but use a third-party payment plan. And if you're going to be shipping to Kahnawake, there's various places that will accept it. It's important that you put your name, your telephone number, your box number, but don't put PO in front. If you do that, there's a good chance that it won't be sent to the community. Many shipping agencies, if they see a PO box, will not ship. So all you have to do is put your box number, say 000 instead of PO box, to the establishment that you're sending it to, and it's important that you use your telephone number. Looking on social media, the several agencies have had a difficult time tracking down parcels, And also, too, we're asking for people to use some common respect. If a parcel arrives that doesn't belong to you, try and get in touch with the person who it belongs to. There's been a lot of information shared on social media. With that, I'm going to leave. There is a task force meeting tomorrow, and you can expect updates for Thursday for sure. Anyway, have a safe evening, Kahnawake.
And thank you very much, Arnold. All right, just a note, Arnold was talking about the home visits, something we talked about at length in the last couple of weeks. After the program today, we'll be showing you a video that will help maybe explain some of the finer points of that. All right, joining us now is the Executive Director of the Kahnawà Memorial Hospital Center, Lisa Westaway.
Good afternoon. I have a mishmash of information to share with you today. I'm going to start with the Sunday drop-off. So I just want to re-clarify again what is allowed and what should not be brought into the Sunday drop-off. A reminder that we do have a Sunday drop-off this Sunday at 10 o'clock. At the last, one thing that's very important, at the last drop-off we had Christmas decorations that were brought in. So this is okay, this is appropriate. However, we cannot accept anything that requires to be plugged in, so anything electric. The reason for that is we want to avoid fires. We have to make sure that we have the infrastructure that could support it, and so it's better to not have anything plugged in. We cannot accept any big decorative items like Christmas trees, because this has an impact on our ability to organize our social distancing within inpatient. And we need all the space that we have right now to be able to continue the activities that we provide to our elders in inpatient. So it's very important that we not bring in any big decorations, but you can bring in smaller decorations for your loved ones' rooms. Of course, it's best if it can be wiped down, but that can be dropped off. For food, we ask that any food that's brought in be able to be kept at room temperature. So to please not bring in anything that needs to be reheated or refrigerated. So anything that's at room temperature is fine. It's always best to have pre-packaged food. However, something that's brought in a plastic bag or in a container can be cleaned, and therefore that's okay as well. Flowers are also accepted. Clothing, however, please ensure that it's well labeled. Again, we ask that nothing be dropped off outside of the drop-off hours, so at security or at different times in the day, because we do have a team in place at those drop-offs that ensures that whatever is brought into the hospital is done so in a safe manner. So I know it's complicated, but every single policy that we implement is really for everyone's safety. So again, that's our main goal, is to ensure that we don't bring COVID into inpatient, and that's why we have rules that sometimes seem a little bit strict. So that was the first point I wanted to address. Secondly, if we stay on the theme of inpatient, just reminder, and if you haven't heard yet, you will soon be receiving a phone call that we do have a family Zoom meeting scheduled for this Thursday, the 26th at 6 o'clock. So you may not receive an invitation by mail this time, because you will be receiving a personalized phone call, and because many people have stated to us that they do not get to the post or they do not receive the messages that we send by mail. So you will be receiving a personalized phone call. The family Zoom meeting will be this Thursday at 6, and we will be discussing elements regarding the holidays and visitation and activities. So again, on that holiday and visitation theme, we do not have a lot to tell you about today, because we are working on this right now. So there are two kind of things that I wanted to discuss. Number one is activities that will take place within inpatient, by our staff for the residents. So that schedule is in the process of being developed. There will be food themes, activities, many different scenarios that we will be proposing so that your loved ones are kept busy and have many activities that ensure social contacts throughout the holiday time. And I'll be presenting that to you next week, and a little bit more also at the family Zoom meeting on Thursday night. And we're also working in collaboration with KSCS for the Elders Lodge, looking at ways that we could ensure better and more contacts during the holiday season between you and your loved ones. So details regarding that will be coming to you shortly, but I just wanted to let you know that we are working on these elements, that they are important, and we know they're important to you. They're important to us as well. They're important for your loved ones and those that we take care of every single day, and we will be presenting some options to you to improve those contacts over the holiday season. I'm going to switch now to the testing site. So first, I'd like to give you a summary of the community health check that was done in October. So it's been a little while since we've made those phone calls, but I still want to give you the results, even though they may not be significant today. They are very interesting. Results from October, which is just a month ago. So of the 872 calls that we made, we did reach 524 people. So we were able to do 524 surveys. And when we look at the amount of people that live in the home, this actually represents 1,100 individuals. So this is just over 10% of our population. So it is still quite significant. So thank you for answering your phone. Thank you for participating. This gives us a lot of information about what's happening in the community. So of those that we did survey, including those in the home as well, 99.3% said that everyone was well, that they did not have symptoms, and this is really encouraging for the community. So important that we transmit that information. We also want to we did ask the question about travel. So there were very few people of those we spoke to that have traveled outside of the province. In fact, 4 people said that they had, 518 people said that they hadn't. There were a couple of people who did not want to answer the question. Of those who have had a direct contact with a COVID-19 positive case, only 1.35% said that they had had contact with a positive case. So 93.85% said that they had had no contact to their knowledge with a COVID positive case. One thing that was a bit of a change from the last surveys that we had done is that there were an increased amount of people who stated that they could benefit from mental health support. And that's an important question. We've been talking about mental health quite a bit over the last few weeks. And so again, we encourage you to use the resources at your disposal should you have that need. And those who did state that they had a need for mental health support were reoriented appropriately and according to their wishes. So those are the results of the health check. They are encouraging, and they are telling us that people are following the rules and looking out for their well-being of them, for themselves and for the collective. So let's talk a little bit about results of the testing site. So we've had a total of, since the beginning, a total of 38 positive cases in the community. At the present time, we have 0 active cases. In the second wave, we've had 17 positive cases. We've had pretty much a trickling of positive cases over the weeks. So and what we've seen is that we've had an ability to identify the positive cases, reach out to the contacts, and isolate people in accordance with the rules so that we contain the virus as much as possible. And because we've been able to do that, there has been little transmission over big groups. So we don't have big outbreaks in the community. We have small groups of people who are positive. And that's what we want to see. So it means that the community is doing a really good job of following directives, of making positive, healthy choices, cases. And so this is having a positive impact on the community. So again, right now we have 0 active cases that we know of. So it doesn't mean that there aren't any positive cases, but of those tested, we don't have any positive right now. We are still testing quite a bit. So our average ranges from 10 to 20 people per testing day. When we have more people, we open up more hours. When we have less people, less hours. However, we still have quite a few people calling in to be tested. And again, that is very positive. We are thankful for that, and we urge you to continue to call us when you have symptoms. We also have many people who are calling into our local public health team to ask for advice or information if they have been in contact with a positive case. Because we do have community members who have contact with positive cases from outside the community, and I'm glad that people are calling and asking for information, because this allows you to make proper decisions, again, that protect the collective. So we urge you to continue to do so. So the last element about the testing site that I wanted to cover with you is the fact that we have modified our organization of the testing site. So with winter coming, we had to make a few changes. The tent that we had in place was not the best for the winter months and would have brought about some difficulties with snow clearance. And so we now have a smaller tent that is heated for our workers, or better heated for our workers, and the configuration of how the testing happens is a little bit different. Instead of a drive right through, you're now driving into a tent and then backing out of that tent. And the person who will be performing the test will come to you within that tent. So you'll see if you come in that it looks a little bit different. We will be showing the changes on our website as well, although we haven't done that yet. The changes have just taken place, but I wanted to just advise you not to be alarmed if you show up and the tent is a little bit different than before. Lastly, I wanted to present to you a conference that will be taking place on Friday, November 27th at, it's on Monday, November 30th from 6 to 7:30. It's called Good Mind Teachings with Tom Porter. It's organized for all community members and any employees of community or Kahnawake organizations, actually. And it's really about focusing on our culture and our traditional teachings as they are intended to keep us well. The deadline to register is November 27th at 12 o'clock. And I will provide the information on the KMHC website and on our Facebook page. Should you want to register, you can do so with Candida Rice at KMHC, and I'll provide her email address so that you can do so. So if you are interested, we urge you to participate. That's it for my updates today. We do have a task force meeting tomorrow. The main topic will be about the holidays and how we can provide you with the best safety measures possible so that you can have a wonderful holiday season. And so we'll be getting back to you about that on Thursday. Thank you.
And thank you very much, Lisa. And again, there will be plenty to update you on, I expect, on Thursday and the days to come as the pandemic continues to really ravage the country. If you look at the numbers, they're actually astounding, and it doesn't get any better in the States. But we in Kahnawake, so far, so good. Stay the course. Wash your hands, wear a mask, keep safe social distancing. Before we leave, just a little note that coming up, after the credits, we'll be running a short video for those who need maybe a little extra clarity on home visits and how to do it, and just some tips on that. Watch the video. It's very short. It'll be done right after the credits. So on behalf of everybody at the Kahnawake COVID-19 Task Force, we'd like to say thank you for watching, and stay safe. We'll see you next time. Onigiwahi.
Kahnawà COVID-19 Task Force wishes to advise the community that effective Friday, November 13, 2020, private home visits are permitted between a maximum of 2 households at a time. To help, the following safety guidelines will ensure a safe visit with your guests. It is strongly recommended that visits be limited to once per week. Before the visit, ask your guests to wash their hands or sanitize frequently. Keep a record of the date and who visits in case you need it later. Visits are limited to the number of family from each household. If distance cannot be kept, reduce the number of guests. Masks must be worn, hands washed and sanitized, and a 2-meter distance maintained for people not in the same household. Private home visits are not parties, gatherings of multiple households, or multiple family members from different households. Private home visits should not take place if you have COVID-19, have COVID-19 symptoms, have been in contact with someone who has COVID-19, are awaiting test results, are in self-isolation, are at risk, such as over 70 years old and the immune suppressed, or live with or take care of someone at risk. Avoid using air conditioners or fans. Clean high-touch surfaces in homes such as faucets and doorknobs before guests arrive and frequently while in your home. Dedicate 1 bathroom to guests and 1 to you, if possible. When serving meals, no buffet style or self-serve. Individual meals should be served. Seat people from the same household at the same table. Identify glasses with names and no sharing of items. Keeping these safety guidelines in mind will ensure a safe and enjoyable visit with your guests.